So I am working on the YouTube Health Initiative in the UK. It's a global initiative. The idea is to make it easier for viewers to access authoritative health information across the world. And so if you search for any health topic on YouTube, at the top of the search results, you'll see a shelf labeled from health sources. So that contains videos specifically coming from authoritative sources. And each of those sources then has a label, an information panel against its channel to say from a licensed doctor, from a licensed nurse, from an organisation with a licensed healthcare professional, or from an NHS organisation. So the idea is that we're trying to provide that kind of context for the viewers that want to access credible, authoritative health information. Of course, underneath that shelf, there is then a range of other videos available on that particular topic. So we've been working very closely with the NHS national teams, as well as various different trusts, health charities, and individual kind of clinician creators. We've got a couple of Azmain and Virginia in the audience today are individual content creators, and so we really start to create a community around those clinicians and empowering them to create an impact beyond the four walls of their clinic. But then ultimately, it's of course about the individual, it's about the patients out there, and the idea is to be able to empower and educate them with this high quality information, whether that be in terms of self-care, in terms of managing chronic diseases, in terms of helping to provide support to a relative or a friend of theirs that may be recently diagnosed with a condition. So, there's lots of different use cases for which people are searching for health content on YouTube. We're trying to make that process a little bit more kind of medically accurate and rigorous for them when they do so.
Vishaal, thanks. Thanks very much. I just tempted to ask a quick question before we move across the panel. So a shelf, English language material from authoritative sources. How do you ensure veracity and relevance?
So we attempt to do that at a source level. So we've worked very closely with the NHS England team and also with the Academy of Medical Royal Colleges, and they have put together a working group of experts independent of YouTube, and they've created a health information sharing standards document, which you can find on the AOMRC's website. And so organisations or individuals have to self-attest against that set of standards. We will then also check the medical license of every organisation or individual that is applying. So if it's an organisation, they must have a healthcare professional working on their content that they are applying on behalf of. And then we will also do checks and balances on their channel and make sure there's not been any previous misinformation. So that's how we do it at the source level. There's then an ongoing process which we can get into around reviewing every single piece of content that is uploaded. But yeah.
Vishaal, thank you very much indeed.